I discovered I had HIV about 5 years after getting clean and sober, which is about 29 years ago. I realized that I was in a high-risk group and I should test for hep C, and had a biopsy done and found out that I already had cirrhosis. I was probably the first co-infected patient to go on Pegasus and ribavirin, and I'm probably the first to do the first co-infection study. The site opened, which was in Puerto Rico. And within 4 weeks, my liver enzymes were undetectable. And I was cured. It's been about 12 years now since I'm cured. But now, because I had cirrhosis, this is a very important clinical point for patients. Once you're cured, even if you had cirrhosis, you still have to do an MRI every 6 months for the rest of your life to see if you have cancer. Because if you had cirrhosis before you were cured, there's still a small risk that cancer could develop. I've dedicated my whole life to HIV and hepatitis C, to educating patients, to changing the research agenda. I started NATAP at the time. I started out in my living room with $2,000 in funding. And about 2-3 years later, I realized the hepatitis C problem with co-infection, and then I started going to hepatitis conferences. And I started doing the same thing that back then with hepatitis C. Today, the website gets 2.3 million hits a month. It's probably the leading resource for conference coverage globally. We have a window of opportunity now with the aging of the hepatitis C population. Most people with hepatitis C got it 30, 40 years ago, 20 to 40 years ago. They are now aging, and we have a window of about 10 years before they start dying off. And if we don't get services, testing, and care and treatment in the clinics for these patients, a lot of them will die.